My name is James Wassam, and this is my video discussion for week 3 regarding informed consent. The prompt for this week was that we find an informed consent form and compare that form to the ACA Code of Ethics 2014 and to our state board regulations and how that form differs and is similar to those regulations. The state regulations that I refer to are for Virginia, who I hope to be licensed through. And the informed consent letter that I found is from an LPC, LFMT in Austin, Texas, that works for the Austin Counseling Group by the name of John Howard. Now, Mr. Howard's informed consent letter is very extensive, and what I found through that is that almost everything in his letter is covered by both the ACA, the Virginia regulations, and the Texas regulations when I researched those as well. It's very detailed and goes into great depth on each one of it. He divides his letter up into headers to let the client know exactly what they can expect and details exactly what is covered by his treatment, his therapy, and what they can expect to get out of it. Now, he starts this off by describing his nature of therapy, which is covered in the ACA. All of these topics, in fact, that I'll cover are covered by the ACA Code of Ethics 2014. And he goes through it and discusses that he doesn't necessarily give a particular school of thought that he'll be following or a type of treatment that he'll engage in. What he does is give a list of criteria of what he believes makes for good therapy. And the very first one that he starts off with, which is a reoccurring theme throughout his letter, is a good patient-counselor or client-counselor relationship and interaction. He believes that this is the most important thing to effective treatment, that there is a good relationship and that there's hard work on behalf of both the client and the counselor to reach the client's goals. So that's the first thing he sets forth. He talks about the good relationship. He talks about how therapy is hard work, that a client can expect to be fatigued from it, that it's mentally exhausting and it can stir up a lot of emotions and feelings, and that clients may feel inclined at some point to stop therapy on the verge of a breakthrough or because they feel mentally fatigued from it. And he encourages his clients not to do that, not to stop prematurely, that the durations may be, it may be short counseling or it may be long counseling, but in either case, that there needs to be a therapeutic transitioning out of counseling, and that transition needs to be proper and it needs to take place in a proper way so that the client can benefit from what the hard work that they've already done in therapy. The next header that he goes into is how therapy works, and he discusses that it's the relationship between the client and the therapist, and that he doesn't confine himself to one specific way of doing it, but that he does it through role playing, conversation, exploration of feelings, developing greater ways of emotional tolerance, which is not a phrase I had come across before. So that was in there as well. And then he talks about the 3 major contributing factors to successful counseling, which again, he reiterates, it's the relationship between the client and the therapist or counselor, hard work on behalf of the client and hard work on behalf of the counselor to explore, learn new techniques, to guide and teach, and for self-improvement for them, which I thought was something very professional to put in, that there's ownership on behalf of the counselor as well to make sure that this is good therapy. Then he talks about, the next header is the multicultural awareness. He talks about being open-minded to other cultures, that he has respect for other cultures, and that he'll do his best to observe what other culture differences there are there. Then he goes into confidentiality, which is covered extensively. He talks about confidentiality being of greatest importance between the client and the therapist, that it fosters good trust, and that clients can expect not to have their identity divulged, even when he's conferring with other professionals, but he does ask for consent if the client is already seeing other doctors, that he be allowed to discuss their treatment with the other professionals. But again, their identity will not be taken out of that circle of professionals. Then he goes into specifics under Texas law of when confidentiality will not apply, and that is in the abuse of a child, abuse of the client, or self-harm or danger to others. And also, he throws this in, if the client were to bring a court case against him, he may use what was discussed in therapy for his defense. Then he goes on to fees and payments, which again, covered in the ACA Code of Ethics. There is an expectation there of how much he will charge and what the client can expect. Then he goes on to referrals, and he discusses how if he is not equipped to handle what is being presented to him, then he will, for the betterment of the client, refer the client out to another professional so that they can seek help in their desired area to meet their goal. He talks about emergencies, how he's not equipped to deal with emergencies, and he provides the mental health hotline number, and he provides, of course, 911. And then he wraps it up with an actual blurb at the bottom that sums all of the 5 pages up into informed consent. And this touches on various aspects that he had talked about beforehand, and it details in there that the client may stop treatment at any time, and if they're ever uncomfortable, they need to voice that they're uncomfortable so that he may make proper adjustments, because treatment and therapy is about trust between, again, the client and the counselor. Now, his letter was very thorough. It covered many things. It's extensive. The things that I found that weren't covered in that the ACA Code of Ethics does say should be included in there was the continuation of counseling services upon incapacitation or death of the counselor. Mr. Howard has nothing in his letter about what would happen with counseling services continuing if he were to become incapacitated or die. The inability to give consent. His letter doesn't mention how he deals with patients that are unable to give consent. And then it also doesn't mention, which the ACA Code of Ethics does, mandated clients. And I think the reason for this is because Mr. Howard is private practice, and so he's either not dealing with this patient population, or he's not including it on this list of services. He only had 2 informed consent forms, and it was for individuals and for couples. In regards to this, when I was doing other research for it, I came across an article written by Anderson, Newman, and Matthews in 2017. And they detailed in their article that informed consent has come a long way in the field of counseling. And counselors themselves are doing a good job in integrating this and making this something very upfront with the help of the ACA Code of Ethics. But what they did find in their research was that most participants feel that informed consent doesn't meet the intended objectives most of the time. And I think the reason for this, or what they're saying, is actually covered in the ACA Code of Ethics when it states in there that informed consent is an ongoing part of the counseling process, and that counselors should be discussing this throughout the counseling process with clients. And because counseling evolves, to meet the goals, sometimes we have to change techniques to evolve the strategy to get there. And so that can prompt new avenues and new things that have to be done in counseling. And so that should always be discussed between the client and the counselor about how we're going to reach those goals and those objectives. And that needs to be revisited and periodically discussed throughout the counseling process. Thank you.